హలో, నా పేరు రామారావు. నేను వాటర్ క్యాన్ బిజినెస్ చేస్తాను. మా ఆవిడకి తలలోన ఎనోరేజియం వచ్చింది. దాని గురించి అందరికీ చూపిస్తే చూపించిన తర్వాత లాస్ట్కి 7 ఇయర్స్లోనే శివశంకర్ దళాయ్ గారు ఆయన ట్రీట్మెంట్ చేశారు. ఇప్పుడు మా ఆవిడ చాలా బాగుంది. 6 months అయ్యింది. ఏ ప్రాబ్లం లేదు, హ్యాపీగా ఉన్నాం.
This is a middle-aged lady who came with a sudden onset headache and disoriented, having a lot of neck rigidity. Came to us and we investigated with a CT and CT angiogram, and we found that the patient was having acute subarachnoid hemorrhage, and the angiogram was demonstrating a twin aneurysm on the posterior communicating segment. So we decided to go ahead with the treatment, and interestingly here, although the patient had acute onset of acute subarachnoid hemorrhage, it was difficult to manage those twin aneurysms because of this anatomy with only a balloon assisted coiling. So we did a stent assisted coiling, and safely it could be done with the new antiplatelet that is available to us nowadays. So we did stent assisted coiling, and she recovered completely within about 2 days time, and she was discharged, and now she has come for follow and doing pretty well. So this is the angiogram of the left carotid artery, and we can see there is an aneurysm over here on the PCOM segment on the left ICA, and there is a small aneurysm too. So this is a segment of the vessel which is diseased, and that is giving rise to these aneurysms. So we have to reinforce this segment. So my idea is to put a stent, but because if it's an acutely ruptured setting, I will see if I can just get rid of this with a balloon assisted coiling, and then subsequently if required then we can put a stent, but that is the plan. And so this is my catheter going into the smaller aneurysm, and I could manage to do a good job with the coils over here, and we got a coil over there. Then I am trying to navigate my microcatheter into the larger aneurysm. So before that, this is check angiogram, which is showing that this is nicely packed over here. So let me see. So now this is my catheter into the larger aneurysm, and once I'm here, I'm trying to put some coil, but they are not staying there, so hence I decided to put a stent. So this is an atlas 3x21. This is the distal marker of the atlas, this is the capture wire, and these are the proximal marker of the atlas. So the atlas is deployed nicely across the neck of the aneurysm, and for an acutely ruptured setting, I always love this atlas stent more than a braided stent. That is because this is less thrombogenic and it will give a good radial strength. So even if there is a vasospasm, we have some protection because of this nice atlas stent over there. But if it is if it is not a ruptured aneurysm, I prefer a braided stent because they give us some flow diversion property. So once I have put the stent, I'm going through the stent and into the sac of the aneurysm, and then we will go ahead and coil it. So with the stent also there were quite some challenge to keep the coils over there, but we could manage to put in a lot of coils over there, and now we can see the smaller sac, the larger sac, and the coils going around into the basket of coil which was made with longer coils, and further filling of this aneurysm, which looks pretty good. And these are possible because we have ticagrelor, which starts acting within 30 minutes to 45 minutes, so where you don't have to really wait for long with antiplatelet in an acutely ruptured setting. So we are pushing in more coils everything is looking pretty good. These are the coil mass, this is the stent across these two aneurysm. It's a very atypical thing, and we have coilover in the smaller aneurysm and the larger aneurysm too, with a stent firmly sitting at the neck, and few more coils. There is a very good flow into the cerebral circulation, so we are quite happy. Everything is going according to the plan. This is the angiogram, which looks quite fantastic over here, as we see the coil mass and the filling of the MCA and the ACA, and I'm quite happy with that. And this is the coil mass with the stent across, and the twin aneurysms, both aneurysms are treated with a stent across the neck of the aneurysm. So this is how it looks like. So we can see these two aneurysms with a stent across them. We are quite happy here with few more coils inside. So this is my coiling catheter, which is going across the neck of the aneurysm through the stent into the aneurysm. So I'm trying to push my next coil, which is just sitting over there. That is what is desirable, and beautifully going smooth. And this is the detachment zone. Our coil, the distal part of coil, the catheter will have two markers, one distal marker and one over here, and that's about 3 centimeter. And this is the coil marker, and once we apply electricity, there will be detachment of the coil at this juncture, and it's quite a nice coil mass. And this is the angiogram that we get with a stent across here. We don't have to really pack it further, so it looks pretty good here. And I'm going to stop, and this is quite satisfactory. As we can see, the stent across, both the aneurysms are coiled, and patient is doing well.